Good morning, guys. Let's break this down even further. We've already discussed the importance of daily injections to attempt to mimic your natural physiology and potentially mimic diurnal variation. So let's go further. Let's go deep. Let's go real deep. The literature says that the average man produces between 5 and 7 milligrams of testosterone a day. Now, we know that testosterone levels are dropping, primarily because of the environment, stuff that we do to ourselves, us naughty boys. So yeah, there's lots of factors involved in that. So let's not go into that because that's a smorgasbord and a very interesting discussion, but it'll all be theories. Estrogens, cattle, those cows pumped full of estrogen to make the milk, and then it all going into the water. That's it. Okay. There's lots of reasons, plastics, etc. So the average man currently produces between 5 and 7 milligrams of testosterone a day. Now, we don't want to be average. We want to be superhuman. No, we don't. We want to be normal. Okay. So if testosterone levels are dropping, and they are, let's raise that number. Let's just do it for fun. So let's say the average man should produce 10 milligrams. Hell no, let's go crazy. Let's say 12 milligrams of testosterone a day. So in a week, that's 84 milligrams. Now think about your testosterone dose. The Americans, some people advocate a starting dose of 200 milligrams a week. So we've jumped from natural production of 84 milligrams to 200 milligrams a week. And some people say if you don't feel great on 200 milligrams a week, just keep increasing the dose until you do feel great. So some of these guys are reported to be on weekly doses of 300 milligrams of testosterone a week. Let's go back to the higher number than average now of 10 milligrams a week, or 12 milligrams a week. We went crazy, didn't we? So that was 84 milligrams. So from 84 milligrams of natural production to a starting dose of 200 milligrams, and then incremental increases to make you feel great. So some of these guys, 300 milligrams. Wow. You are so far removed from your natural physiology. It's absurd. So let's talk about effective doses, effective methods. As you guys know, I am not a proponent of transscrotal testosterone cream. Let's just take the strength of this cream, 200 milligrams, and you're applying it once or twice a day according to effect. According to effect is interesting, isn't it? Because it comes down to, again, knowledge of the half-life of testosterone. So again, between 10 and 100 minutes. And if you're applying a cream that does not have an ester attached to it, it's essentially being metabolized as quick as it can be. So what's happening? You are having a massive peak and a subsequent massive trough. Unless that testosterone binds to SHBG, and then you have a slightly smoother ride. But let's go back to that strength, 200 milligrams. And let's go back to our average production of testosterone in a day. So we went high, so we went to 12 milligrams. And you're applying a cream that has 200 milligrams in it. Effective, 200 milligrams down to 12 milligrams natural production. Can you see the miscompute here? Miscompute. It's too early in the morning. Does is that sinking in? You're using a cream, say 100, say 200 milligrams once or twice a day, and your natural production is the high number, 12 milligrams. Yeah, makes sense? Doesn't make sense, does it? So these guys that are advocates of the transscrotal testosterone cream, they like it because obviously it gives them a spike in DHT. And DHT, it helps with libido and it helps with muscle growth as well. And it give you a sense of well-being. Is it well-being? Because the reality is essentially after time that excess DHT tends to have a negative impact. We've spoken about the need for normality before, so I'm not going to go on about that again. What else happens? Because obviously you're rubbing this high strength cream into a very thin skin. So again, one of the purported benefits of the cream or application of the cream to the testicles is the fact you get higher absorption. So 200 milligrams to a skin surface that has high absorption. What else happens in the testicles? There's aromatization. There's aromatization of testosterone to estrogen. Now, we've spoken about this before. That actually has a really important role. You need estrogen, 100% you need estrogen. But within the testicles, the primary purpose of estrogen is to help with fertility. So it's to help facilitate the Sertoli cells of the testicles to work. The other topical solution is traditionally Testogel, so 50 milligrams in a sachet. It's now coming in a pump, and actually the testosterone is only about, I think it's about 42 milligrams, not 50. So yeah, that's traditionally applied to the shoulders, abdomen, inner thigh. Don't apply it to your testicles because it's got alcohol in it, and it's likely to burn. Unless you're into that thing. It's much like that minty shower gel. Gives you a little tingle. I quite like that. but I'm not too sure I would like the alcohol gel from Testogel burning my testicles. So yeah, avoid that. So is Testogel a better option than transscrotal testosterone cream? Kind of is, kind of isn't. It kind of isn't because of an inadequate dosing. So if you are on testosterone gel as a monotherapy, it's unlikely you are going to get adequate levels. Now, what are adequate levels? Now, according to the BSSM, that's a total testosterone between 15 and 30. Now, you will not have a decent free testosterone with a total testosterone of 15 unless you have an incredibly low SHBG. And what are we trying to achieve? We're trying to achieve normality, so we're trying to actually raise that SHBG. So even if it is effective at 15 and you have SHBG in single figures, we don't want that to stay like that way. Put my teeth in. It's an inadequate dosing in the vast majority of guys. Now, I do have some guys on the gel, but as you guys know, I'm a proponent of HCG, which mimics luteinizing hormone. So in these guys, we're actually doing what we set out to do, which is hormone replacement therapy. We know that testosterone suppresses the pituitary, so HCG is part of my standard TRT protocol to maintain the function of LH within the body, which extends further than simply the testicles. So what we're doing with the testosterone gel guys is what we're doing with the testosterone cypionate guys and the testosterone enanthate guys and libido guys, because we'll get into that in a bit as well. We are using HCG to maximize natural production stroke function and topping up with testosterone. This is something that most people do not understand the importance of maintaining function. When you have testosterone deficiency, it seems logical to simply replace the testosterone. When you understand the HPG axis, it seems illogical to simply replace the testosterone. It seems more logical to replace the luteinizing hormone with HCG and top up with testosterone, maintaining function for as long as possible. So that's what happens with these gel guys. We're maintaining as much function as we can with the HCG, and we are topping up with testosterone. So I have got some guys who do not want to change. They are happy as Larry. And if you are happy as Larry, and who's Larry? And your numbers are great, and when I say great, I mean within normal physiological parameters, why change? And the answer to that question is, indeed, why change? So, our gold standard treatment at the Men's Health Clinic is testosterone, cypionate, and HCG. Why? Why cypionate over enanthate? And it comes down to the oil and the preservative. In enanthate, the oil is sesame oil, and the preservative is chlorobutanol, which is quite irritative. And you'll notice the difference in fluidity between enanthate and cypionate. Cypionate is far more fluid. It doesn't have chlorobutanol. It has a small amount of benzoyl alcohol. So it makes it a far more suitable TRT choice for subcutaneous injections. And why do we like subcutaneous injections? We like it because if you're going to be injecting yourself for 50 years into the muscle, ouch, into the subcutaneous tissue, it's far less painful. What else? Subcutaneous injections lead to less aromatization. Now, we've spoken about the importance of estrogen before, so we need a healthy estrogen, but we don't need excess estrogen. So subcutaneous injections actually cause a slight decrease in estrogen compared to intramuscular injections. Sinking in, guys? I hope so. So, my starting dose is less than 100 milligrams. Shock horror. So if a superhuman is producing 12 milligrams of testosterone a day, why is my starting protocol actually a little bit more than the 84 milligrams? I mean a little bit more, a very smidge more. It's because of bioavailability. So you do have to factor that in. And the only way that you can factor that in is through experience and blood work. So if somebody was having more than they should have according to physiology and the numbers weren't correlating, you just have to have a logical and methodical approach to this and realise that the bioavailability is not 100%. The bioavailability between IM injections and sub-Q is comparable. The only difference really comes from the estrogen. Is that true? Yeah, that's pretty much true. There can be a very slight, subtle variation between IM and sub-Q, but it is certainly not dramatic. So what we're attempting to do is get the testosterone ester into the bloodstream. Now obviously intramuscular goes straight into the muscle, which is highly vascular. Subcutaneous tissue isn't so vascular. It has to go into the capillaries and lymphatic system. So it's essentially just delaying absorption. The downside to enanthate in this discussion is the irritative effect. And when we have switched guys over from sub-Q enanthate to sub-Q cypionate, their total testosterone level has actually been slightly higher. which is interesting. So it must demonstrate the fact that the absorption from enanthate and cypionate when it's sub-Q is slightly different. There'll be no reason to suspect there's a difference between intramuscular enanthate and intramuscular cypionate. So, have we covered everything? Yeah, it's been 15 minutes and I need to get to work. I am at work, but I just need to actually do some work. So, average man, 7 to 9 milligrams. Average man a few years ago, let's say for argument's sake, 12 milligrams of testosterone a day. So you should be having approximately 84 milligrams a week. Starting doses in America are sometimes 200 milligrams a week, which is absurd. We should be looking at testosterone as hormone replacement therapy. So maintaining function with testosterone and supplementing with maintaining function. Sorry, I'm just distracted by mosquito. Maintaining function with HCG and supplementing with testosterone. Some of my younger guys are on as little as 35 milligrams of testosterone a week, which seems absurd because we've already said 84 milligrams would be optimal. It's because of the HCG. So it's because the HCG is maintaining intratesticular function and production of testosterone. So we are topping up with testosterone. Now, to me, that makes sense. That makes sense from the perspective that we are maintaining function, and this is hormone replacement therapy, not simply testosterone replacement therapy. Make sense, guys?